Good morning, everyone. My name is Suzanne Martin and I'm the Chief Allied Health Professions Officer for Northern Ireland. It's a real privilege for me to be asked to say a few words for this morning's event on this critical topic. An outcomes-based approach has defined strategic planning across the public sector since 2016, and I'm delighted that the Royal College is not only holding this event but holding it on this topic and also embedding it as a focus on outcomes into this work. Your work in this issue reflects the approaches taken in the programme for government and in the messages contained in the New Decade New Approach. The delivery of health services in Northern Ireland relies upon teamwork and partnership, and it is an immense satisfaction that our approaches are aligned, as this makes service delivery so much easier. Through your work on measuring outcomes and collecting data to support this, we in the Department of Health can utilise this evidence-based approach for the provision of speech and language therapy services in Northern Ireland, whether it's through funding the workforce or research or identifying other areas of need for transformation. The measurement of outcomes associated with speech and language therapy is essential, and it's a component of delivering effective, high-quality services. The Royal College has already identified that outcome measurement is core to delivering evidence-based and person-centred services, evaluating clinical effectiveness and supporting quality improvement, demonstrating the impact of speech and language therapy. An outcome measurement is of course also a requirement of the Health and Care Professions Council. In order to measure outcomes, the collection, collation and analysis of data is central to that. You are leading the way in your support for members through the collection of outcomes data, which will demonstrate the transformative impact of the therapy for individuals with speech, language, communication and swallowing needs. Your approach in identifying intended outcomes, measuring these, collecting data, analysing it, presenting it and using it to sustain, influence and create change is a sound one. With my background in research, I applaud the use of this methodology to guide your work. In 2020, we in the department published the Workforce Review into Speech and Language Therapy for the period 2019 to 2029. And since October 2016, health and social care workers and the Department of Health have been cooperating to deliver the transformation set out in Health and Wellbeing 2026 Delivering Together. This ambitious 10-year plan was our response to a report produced by Professor Bengoa, who was tasked with considering how we best reconfigure health and social care services in Northern Ireland. The aim is a health and social care system that helps people to stay well for longer, with services delivered in the community or at home where possible. Speech and language therapists will play a key part in responding to this challenge, particularly as we expand the role of innovative multidisciplinary teams across a range of integrated care pathways within health and social care services. The integrated care system in England is one example of this. Here in Northern Ireland, Hospital at Home is another. These are both examples of partnerships working collectively to plan and deliver joined up health and social care services which meet the needs of people, and it's not about systems. In conclusion, I welcome the Royal College's Outcomes Programme and aspiration in the new 5-year vision, and I look forward to hearing about the work that continues to support and inform the delivery of speech and language therapy services in Northern Ireland. Continue doing what you're doing, innovate, provide excellence in research and clinical practice, and continue to champion your field.